Here in the Territory we have a large landmass, 1.3 million square kilometres, small population, 230 odd thousand, a very large portion of which live out remotely in Aboriginal communities out in the bush, long way from generally essential services. Is it a traditional EMR? No, hell no. You can go and find one of those in a big urban hospital somewhere. This is very different. This is a single digital tool for our clinicians right across the jurisdiction, right across every element of clinical care. The litmus test for us is it won't matter if you're a nurse in a remote Aboriginal clinic logging in to treat a patient who presents at the clinic, or you're in the intensive care ward at Royal Darwin Hospital, you will access the same patient record in real time at your fingertips each and every time, and you'll be able to see what care has been provided in all of those other care settings.
What I think is really exciting about the Northern Territory is we're able to solve some very specific problems, but also solve them in a way that's meaningful in other parts of the world and other environments. For example, some of these remote clinics don't have a full-time care provider, often don't have reliable internet connections. So we've built what we call Track Care Remote, which is an offline mode of track care where you can download a cohort of patients to a laptop, bring that laptop out to the remote community. From there, you're using Track Care and you bring that laptop back to the central hospital, and that record then gets merged in with the central record.
One of the significant challenges we have for our Indigenous population is the incidence of chronic disease. And what's so important here is most of those health conditions are preventable. If we can coordinate our care better, if we can get on the front foot early, if we can be more proactive in our delivery of care and services, people shouldn't get so sick.
The population moves around a lot. It's difficult to have set appointments. So a lot of their care is based on care plans and recall lists. And it's very opportunistic. So if somebody comes in for an appointment and they bring a relative, you might take that opportunity to treat the relative while they're there, vaccinate the kids, that sort of thing. And so we're doing some work on the product, and a lot of that work is, I think, applicable where a traditional model of come back and see me in 6 weeks, it isn't really a meaningful way of working with a patient.
InterSystems listened and took the trouble to seek to understand the challenge of delivering healthcare here in the Northern Territory, and they're still listening, and we're working together and it's a terrible cliche, but it's working as a partnership, not just a commercial arrangement. I'm someone who's grown up here in the Territory. My kids have been born here. I'll see my time out here, and I think it's important to me that we leave something behind that's better than what's there today. So if we're sitting here in 20 years' time and we're seeing an improvement in those health outcomes, particularly for our most vulnerable, our Territorians who've got the poorest health now, then that looks like success to me.